Okay, so could you tell us why we're moving over to the borough structure?
Okay. I think the main driver is that part of the South East London Sustainability and Transformation Plan, known as our Healthier South East London, is that we move away from institution-based care, hospital-based care, as much as possible to place-based care, that we work as seamlessly as possible with GPs, primary care, and indeed across health and social care. So the aim is to work around people, patients in their communities, rather than having systems which are designed just around pathways of care. People need to be at the centre of all the work that we do. And I think by moving to the borough structures, we are giving ourselves a good opportunity to be able to work better with people, with the places, and with the voluntary and community sector, people's local networks as well in those communities to best effect.
No, I mean, I'll just reiterate what Tom's already said. I think the onus is on developing good relationships with the range of organisations that we work with. Being organised on a borough basis will really assist that process.
And can you tell us some of the benefits that it will bring to staff and patients?
Well, I think obviously for a number of years now we've been both a provider of community health services and mental health services, and an awful lot has been done in terms of looking at areas where we could integrate further. And I think, again, being organised on a borough basis really will help us to look at maximising those opportunities. So, for example, there's an awful lot of work which is happening on an ongoing basis around the frailty pathway and looking at people who've got both physical and mental health needs. This is an opportunity to look at whether that work can be taken to the next level, really.
And I think building on that as well, we have clear examples, there's clear evidence locally and nationally of the physical health outcomes for people with mental health needs are so much worse. This gives us a chance to do something about that.
And are there any challenges you can see around the new structure?
I mean, I think that the challenges are probably different in each borough, and that's to do with the context. So things like the history of the relationships between organisations, the financial situation of the commissioning bodies in each borough. So they each bring different challenges depending on which borough you're working in. But again, going back to the point about relationships, being organised on a borough basis really will incentivise the system that's in each borough to work optimally and work as closely together as possible.
One of the things I think that we need to understand is that we do need to make some savings out of this reconfiguration, but actually we had to make those savings regardless. The money is reducing, and so this, I think, gives us an opportunity to make sure that we make the savings in the structures, not at the front line, and that we can protect the services that are being delivered at the front line as far as possible.
In terms of visibility of the senior management team, how will that improve or how will that change?
I mean, I think when we were organised in service lines across quite a large geographical area, it was always a challenge, and personally speaking, to really deliver on that promise of visibility. I think that will be easier when we're organised on a borough basis. Plus, I think there is an explicit commitment from the exec to make sure that the senior management teams in each of the boroughs is more visible, and that means going out and spending more time on a regular basis with teams, not just in terms of flying visits, but actually spending time trying to understand what the teams are about, what some of the issues are.
And I think as well that also then gives the opportunity, that local visibility working across specialisms, to identify opportunities for people to work better together, and enabling that to happen through senior management visibility and engagement in that process.
So in terms of the quality and consistency of services, this is something that you'd see would improve and build on that?
I think that there's been an awful lot of quality gains from being organised on a service line basis in terms of having consistency and standardisation, and that's really embedded now, I think, in the management culture. And even though we're organised differently, there will still be an expectation that the boroughs cooperate with each other. And I think one of the things that we'll be doing over the next month or so is thinking about our quality structures and how they will support consistency and standardisation in this new structure. So for example, we might look at putting in place an acute care forum that brings together colleagues from across the 3 boroughs. We already have a district nursing forum which spans both Bexley and Greenwich, and the intention is for that to continue, because these are really important ways of ensuring that key messages go out to everybody and that good practice is shared.
And I think that's one of the key themes is to say is this isn't about getting rid of good practice. Actually, it's about making sure we share best practice everywhere, and that we've got people working together where it's useful to work together, but people working in different places with different sets of colleagues where that's better for the patient.
And children and young people services and prison forensics aren't part of the borough structure. Why is that?
Well, for prison and forensic services, they are commissioned separately. So they are a specialism which is regional or super-regional, so it makes sense for them to be organised separately. In terms of children and young people, I think the agenda for those services is quite different. It's the environment that those services are working within is subject to quite a lot of change. So colleagues within those services have experienced quite a lot of re-tendering activity. And I think it was felt it was important to keep a specific focus on those services, at least for the time being.
And the numbers of people working in those services are numerically much lower than in adult community services or indeed mental health services. So there is something about critical mass as well to make sure that the service is able to function sustainably.
And that goes for adult learning disability services, who are also separate to this change. Again, it's an issue of size really and specialism. Yeah.
Okay, lovely. Thanks very much. Thanks for joining us.
Thank you.